out your phone just to see, like when we go live, you'll be able to see it. And also monitor the chat. I'll be looking, I have my phone right here, but just in case I miss something, like someone has a comment or question, we can get them filled right in. So, all right. So it looks like we are live, ladies. So we are going to jump right into this conversation. I'm so excited for it. It is Wednesday.
Oops, hold on. Okay.
Okay, you got it now. Okay, perfect. So it is Wednesday, and Wednesday is quickly becoming my favorite day of the week because I get to spend it with you. For the show, Woke Wednesday. And today, the conversation is around health disparities. So, healthcare, what's race got to do with it? My name is Teese, and I am the host of Woke Wednesday, which is an urban TSYR series that explores relevant topics of discussion to help us stay woke. That is to remain current and informed or to get woke, to learn something new and to gain a new perspective on what's happening in the world, in our communities, and in our personal lives in order to become healthy, happy, and whole. So, today we will be discussing the very important topic of health disparities and how race plays a part in this long standing issue. I'm really interested in gaining our special distinguished panelist perspectives on this as insiders in the medical industry for understanding what the data says and also what they think needs to be done in order for us to make a change toward equity. So today's episode is sponsored by Generation Next. That is an initiative to attract diverse talent to available positions in Central New York in order to foster opportunities for career advancement and connect talented diverse professionals through social engagement and networking opportunities. I will be sharing the plethora of events that Generation Next will be hosting. In fact, there was a great event. If you missed it, you can go to the Center State CEO website. There was one tonight. And they just highlight a number of individuals, diverse individuals within the tech industry. So it's a great series, and I encourage you to check it out. So if you are watching right now and there is someone that needs to be a part of this conversation, share the link and let them know to come right over and conversate with us. So, ladies, I want to start with introductions. I want to know who you are, your perspective, and what you're bringing to the conversation. So, why don't we start with Brandis? Why don't we start with you, Dr. Brandis?
All right. Thank you so much for having me. Dr. Brandis Pearson. I am Director of Community Engagement for a local healthcare organization here in Syracuse. I'm a native of Syracuse. I also have worked I worked my way up from CNA to LPN to RN to nurse practitioner, also a social worker in there, and then a doctorate in executive leadership. And so I've really spent the majority of my career in healthcare or some sort of provider role. So I come from the community. I grew up on the South Side. I went to city schools, and so I've lived this. I've been impacted by poverty. I've lived it, and I've helped others navigate it, and it's a passion for me to talk about.
Wonderful. Thank you. How about we go next to Simone? Welcome.
Good evening. Thank you so much for having me, for the invitation. It's an honor to share the platform with such incredible professionals. My name is Simone Seward, and I am public health trained. I have a master's in public health, and my focus is primarily on public health practice related to maternal and child health issues. I'm also a doctoral student at Albany School of Public Health, where I'm pursuing a doctorate in public health, DRPH, focusing on how to improve birth outcomes for Black women, especially related to preterm birth and low birth weight babies. I also teach at our local university medical students, public health students about social determinants of health and health disparities, and ways that them as future physicians can impact healthcare and make changes in the healthcare arena, and ways that they could also continue to become or continue to be engaged in the communities that they will be serving, and really learning from and about communities in order to understand the context from which their patients are coming. So I am very passionate about this work. I've basically dedicated my career to this and continue to do so because it is something that I truly care about and really want to make an impact. So thank you for having me.
Thank you. Dr. Jashika, you want to jump in there?
Yeah,
Great.
thank you for having me. So, my name is Yashika Dooley, and I am a board certified OBGYN and also fellowship trained in urogynecology. I've been practicing and taking care of women for over 20 years. And my passion really is helping women be able to be an advocate for themselves. As a clinician, I really have seen that this is one of the major contributors to how you can impact your health and make sure that you're getting the health care that you deserve. And so oftentimes I feel like patients just don't realize that. So that really has become my platform. Besides that, I really work on helping physician women of color thrive in medicine and trying to retain as many of us as physicians as possible, because we need both of those hand in hand to really make a significant impact in our community.
For sure. For sure. And then finally, last but not least, Dr. Omalara.
Hi, everyone, and thank you again for this opportunity. My name is Dr. Molara Thomas Uwemadimo. I am a board certified pediatrician, a former associate professor and physician researcher, and I recently have really expanded my work to move into healthcare entrepreneurship. Primarily, I'm the CEO and founder of Strong Children Wellness, which is an innovative primary care practice that we actually take physical health services and try to bring them closer to the community by embedding and integrating those services into nonprofit organizations that provide behavioral health and social services in marginalized communities. And I also am the CEO and founder of Melanin Medicine and Motherhood, which is my baby, my third baby after my two real life ones. And that really comes out of a history of burnout, being an academic pediatrician, particularly as a Black woman, and trying to provide a community for a coaching strategy to help us, particularly for Black women in particular, and help us to gain more insight into our purpose, to overcome the challenges that we have due to medical racism. And I believe those hand in hand are really important in terms of thinking about how do we address medical racism at both the provider level and the patient level. So thank you again.
Yeah, so I picked up on something that we will definitely get into because it's two-sided, right? So we have to be advocates for ourselves, and there are also structural things that we need to try to break down too, because it's been long enough. So we'll get into all of that during the conversation. But I'm just hearing all the passion from each of you on what you do in the medical industry, wherever you're coming from, wherever you sit, in the work that you're doing around health disparities and breaking the barriers there. So I appreciate your work. Thank you very much for what you do. So I want to just start very basic and plain, especially too for our audience. What even is healthcare disparities? What does that mean to you? And just really quickly, short but brief, but what is it? What is health disparities?
So I'd like to talk about that because I do hear the terminology healthcare disparities often. And one of the things that I always try to think about is terminology. And so disparities really refer to a difference in health, and potentially when we talk about them from one group to another. However, I think that a lot of times what we're noticing, especially during this time period, is the word that I'm finding more of us to try to move towards is inequities, and the idea that these differences are not only just differences, but differences that are unjust, differences that are avoidable, differences that are structurally and systemically designed to work the way that they've happened. And so it really is about looking at how certain outcomes, how certain delivery, access, utilization of health differs among certain population groups. And I think most interestingly enough, as someone who's on the intersection of immigration, as someone who's a daughter of immigrants and race, there are many different levels to it, but that's kind of my thought around health inequities or known as health disparities as well.
Gotcha. And that's a good distinction to make, because it's not just a difference for difference sake. This is a difference that causes people pain. This is a difference that, reduces the lifespan of individuals. Like, this is a difference that is having an impact on our community. So thank you for highlighting that. Anybody else want to just chime in on what it means to them, healthcare disparities?
I would say
You cut out for me, Ashika. Dr. Ashika, you cut out.
within the medical community, the care that you receive or don't receive sometimes based on your gender, right? It can be male versus female. It's not just, a race, but I think race has a big impact. But also age. There's lots of different ways that, people come in and look at you, and there's a lot of bias. They're like, oh, she is a young, healthy, African-American female. She probably does not have this. And so they've already ruled out things that you might have, like a heart attack, right? As opposed to if you were an older white gentleman and you come in with those same complaints, they are doing the full workup for a heart attack, right? So it's things that everybody, you come in with the same complaint, but for some reason, they have already started to categorize you based on what they see. And that in and of itself can really change the course of what care you get, and potentially like how well you fare if it is something that could be life-threatening.
Yeah, I echo that. I echo both of those sentiments. I think, the disparities come into play when we realize what people value when they come to care for that person, right? Do you value my life as you would yours or your family members? And I think we see health equity really like rearing its ugly head when we realize what people value. Like, do you see me as a human? Do you value my life and the time that you spend caring for me or my loved one? And does it matter my race, my gender, my sexual orientation? And I think those disparities are preventable or avoidable, but they come with biases, like Dr. Julie mentioned, and it's difficult to navigate.
Yeah, for sure. Now, what would you say if we wanted to use like a real life example of healthcare inequity, of healthcare disparities? What would, just to give context to the definition, what does that look and feel like in real life?
I think for a very generalized one is, women oftentimes can come in with very simple complaints of a heart attack or chest pain, and they will not at all be evaluated for that. And that is a major killer of all people, right? And it's one of those things that we as doctors learn, you want to rule out the things that are going to kill people. And so if you have a woman come in and complain the same thing as a man, but they get treated completely different in something that could kill them, that is an issue, right? And it's more likely that that woman's told, you're okay, you're anxious, you're overworked, you're stressed out, whereas a man would not be told those same things. They are immediately thinking he might have a heart attack or, all of these things. And so I think that is one of, a big one that everybody can easily accept and realize is one that more people, especially in the medical community, can all agree on.
Yeah.
I think another example would be when you look at the breast cancer rates, especially with Black women. Black women are dying at disproportionately higher rates than white women. What are some of the causes for that? Even if they're getting screened at later stages. They're getting picked up at later stages. Why is that? Again, does it go back to the care that they're receiving? Do they have access to the services? Do they even know about the screening programs that are available? So those are just very, simple examples that we can pull. And I mean, there's tons of them. These are just two examples. I mean, look at COVID now. But going back to what Dr. Omolara said, it's linked to those inequities, those social inequities, those structural issues, those access points that are preventable. Like, there's something that we can do about it, and we just need to figure out how.
Yeah.
Yeah, oh, I was just going to say that one of the ways my background is actually global health. So I actually practice quite a lot outside of the US and hopefully decided to bring some of that innovation from low resources here to understanding that the marginalization of populations here is pretty similar to some of the barriers that families and communities have in low resource countries. And one of the things that I learned that really helped to explain this was something called the 3 delays model, which was founded around maternal mortality, particularly in international communities, to try and assess how to address those things. And if we think about it, it really helps, I think, to make it very clear that there's a delay either in knowing that you need health care. And so that's around access to information, access that Dr. Seward was talking about in terms of what are the issues that I need to know. Oh, it's time to get screened. I should go for my well child visit now. Then you have issues around access to actually getting to care. I know that I need care, but I can't get there. So that may be geographic. That may be due to healthcare deserts, right? That may be due to geographic maldistribution of providers, knowing that they're more here than in other areas. And then there's the level of there's a delay once I get to care in getting equitable and dignified, confidential care that really knows my values, respects who I am. And that is, I think, there was a huge outcry. I think Dr. Susan Moore resonated with a lot of us who was as a physician and who I think showed a lot about how even as a physician that there were delays in the care, there were denials of pain and those kind of things. So I think understanding it at those 3 levels is really important, understanding how large it's not just in the healthcare system, but the whole societal and political determinants of care as well.
Mhm. Yeah, and you brought up a lot of good examples of different factors. And I think maybe some of these are social determinants. Now, I don't know because I'm only, knowledgeable enough to be dangerous because I've been doing my research. But what are social determinants and how do they play into the impact of our health outcomes?
So, I mean, I think all of us could speak on that. So I'm like, who's going to go first? But those social determinants. And so the organization I work for has taught me a new term, social influencers of health, right? Because when we say social determinants, that feels so prescriptive, right? Like if how I'm born or where I live determines my health outcomes, then that's almost a death sentence. But it can absolutely influence my health outcome. But I think there are some opportunities for us to navigate through that, and I think I know my story, I know Simone's story a little bit, and so there have been opportunities to navigate and really avoid some of those determinants of health. But that's where you live, where you play, where you worship, where you work, where you eat, where you spend your money. It's the things that we do every day, and I'm sure someone else can speak more articulately to it, but where you reside, your zip code often determines your health outcome, your access to employment, your access to fresh foods, and your access to healthcare. Like Dr. Omalara said, like so many things that we take for granted or that we just do every day can impact our health outcomes. But someone else.
So what I heard was above and beyond race, above and beyond gender, above and beyond what I bring home as a paycheck, even, right? Because I could be doing well, but live in an environment that, it may not be conducive to adequate health care or something like that. So these are all of the other factors that sort of play into healthcare outcomes. Now, with
Yeah,
that,
just to add to that, I usually like to think of it as the individual within their context. So whatever you consider to be your context, if it's your home, your geographic location, your socioeconomic status, where you live, where you work, And sometimes it's easy to kind of say, oh, it's someone's fault that they're not eating healthy, or it's that patient's fault that they're not exercising, or that they're overweight, or whatever their health condition is, but not taking into consideration, where does that patient live? Where does that individual, you know, where can that person access healthy foods? If they're living in a food desert, their choices might be limited to the bodega down the street, which 9 times out of 10 isn't, providing healthy options. So the social context really is important when you're looking at talking about behavior changes, or adopting a healthy lifestyle, because the context matters.
Mhm.
I think this is really important because the thing that has not been spoken about is, of course, the fact that what we found, right, and RWJF, Robert Wood Johnson Foundation, has done a load of work on this as well, but is that only 20% of health outcomes actually are due to what we do as clinicians or in healthcare institutions. And so if we think about it like that, then we realize that a lot of the interventions that we are trying to do, we are pretty much at the down lowest stream of being able to affect change. And a lot of the things that are going to affect change are really policies, are really around engaging with communities. I think first and foremost, if we think about a true example of this, of how the idea that healthcare institutions and facilities have a monopoly on health, right? Instead of looking at the whole society, you can look at the COVID vaccine rollout right now, and you can see that COVID vaccine rollouts, if they're pretty much just located in healthcare institutions, we're not going to do anything. Like nothing is going to happen. And really the idea was, oh, now we see you. Now we see why you're so important. We see why the pastor is important. We see why the early Head Start teacher is important. These are the people that are influencing and interfacing in communities where people spend the majority of their time, not a few minutes with their physician or in a healthcare institution. And so as we think about these inequities, a lot of times the focus when we hear health is thinking health begins in clinics. It actually begins in communities. And so that is extremely important as we think about social influencers of health and thinking about how do we navigate this issue.
Very good. So, with that being said, there was a question that was asked in the chat. I don't want to get too far away from it before we go on. It said, Evelyn says, inequities and disparities can be gender or racial biases. How does one get access to specialists when there is a problem?
I think for a lot of people, it's difficult, right? Because even for physicians, we are often limited in what we can do based on the insurance or what resources that person has available, right? So I can want to send them as their physician to a number of people or have a specialist, but we are also blocked. And I always try to explain that to my patients is a lot of times I am limited by what your insurance company or whatever provider you are with tells me that I can or cannot give you a prescription for, even, right? They might say that they won't refund that prescription, or they won't pay for that, or they won't take care of a referral or a lab that I want to do, or all of that. So I tell my patients, I am also a patient too, right? And so I feel your frustration. But oftentimes, again, it's the bigger system that we operate in. And depending on where you're what your insurance allows, that often is going to limit or determine if and when you can get a specialist visit.
There are some beautiful technologies that are rolling out. One is by a friend, Ashley Wisdom, who really has helped develop this tech around health in her hue, which is really coordinated around trying to make sure that, yes, like you said, a lot of times BIPOC individuals have real difficulty finding health professionals who are culturally responsive and who are concordant. And we know from studies that have been done already around infant mortality, maternal mortality, that concordance does make a difference in terms of the actual and having a physician who looks like you, who has a shared experience potentially with you. And so Health in Her Hue is a really awesome app where it's growing, it's a new one, but where a lot of clinicians have now been putting their information in and trying to make it easier. I remember looking for a therapist and going straight to Dr. Joy Harden. I'm trying to remember her. I think Black Girls. You guys, some of you know. Somebody knows what this is. I can't remember.
Black girl therapist, I think.
Yeah, Black girl therapist. And really, the goal is, while these are not, end all be all, and they're growing, I think it's really important to understand that these are the things that come out of people who realize that these gaps are existing and trying to fix those gaps. So
yeah, people are really paying attention to this. Go ahead, Brenda.
I'm sorry, one more time. Health in Her Hues. Is that what you said?
Yes.
Love it.
We're
I'm
gonna
taking notes, okay?
drop it in the chat.
Yeah, Health in Her Hue, HUE. Yeah.
I hope other people are taking notes, because I wrote down the 3 delays. I'm writing down the Health in Her Hues. I'm like, yes.
You are definitely a scholar. Definitely a scholar. That's great. So that was a question from the chat, and there's one more before we go on, because I don't want to miss these. I have a number of questions, but I want to make sure our audience gets fed the knowledge that they want tonight as well. Sharia asks, what challenges have you encountered trying to address disparities being a minority in your profession? Where can we start?
If I can chime, I worked as a family nurse practitioner in a federally qualified health center in East Harlem for a while. And I think that was kind of my baptism by fire. It was an amazing opportunity, but it was a lot. And so my patients were predominantly Black and Brown. Many of them were newly released from some sort of institution. And so advocating for individuals who had challenging pasts, who also happened to be Black or Brown, asking for, getting pre-authorization for pain medication, or for someone who had a history of addiction, right? And I understand, like, that's potentially a slippery slope, but I have had to really advocate for my patients and put them on like a strict plan, just to prove that they need the interventions that they need. And I know there was like this hashtag at one point, believe Black women. And I felt like I was like screaming that all the time, like, believe Black women, she's in pain, or, she's having these issues or these symptoms that have been overlooked for years. And finally, when you get someone to actually review some labs or review some films, then you realize that she's had fibroids that have grown to the size of grapefruits, but nobody wanted to listen. They were just like, oh, it's premenstrual pain, or it's PMS. And so advocating in a way that that people weren't accustomed to was new for me, and it was rewarding. And I felt horrible when my locums position was up, when the time was up, because I learned so much and grew so much and advocated in ways that I never ever knew I would need to.
Wow.
I think for me, I'm a big proponent of community engagement. So actually building relationships, building partnerships, getting to know the community members. Because I think a lot of times we have a single narrative, we have a single story about a particular community, and we just run with it, right? So I think taking the time to really build those relationships and getting to know key stakeholders that are influencers in the community, and learning the roles that they play, and being able to leverage those roles can help to, bring about some of the changes that we need to see, and the policy recommendations that need to happen in order to continue to move the needle. So I think that community engagement piece is very critical, especially when it comes to engaging with, communities of color. That relationship building is key.
I think we could be here all day answering that question about what are all of the challenges that we've each faced being a minority in our profession. I don't like that. I'm come from a global standpoint, so I'm like, we're a global majority. So yeah, but anyway, but I think that one of the things that I think is really important is, of course, centering the issues that matter to us and matter about our people, and saying that these are not adjunct, nice to do things for healthcare institutions. These are so core and so important. I think a big issue has been trying to come into these spaces that were not designed for us, right? They never thought that we would be in these spaces, and having to work slowly, trying to not jeopardize your position here, but also trying to push and trying to break and trying to open spaces that allow for more and more of us to come into there. And I think, you know, that means dealing with a lot of trauma, dealing with people who underestimate you, dealing with people who question who you are. I remember many times having a white coat, stethoscope, and being asked to carry the tray and being mistaken for housekeeping, quote unquote. And so I think there's a lot that goes into this, and a lot of us, you know, we use that strong Black woman trope to basically kind of like keep it all together, but hold and carry a lot of stress. And just like all other Black women, you know, I think the white coat does not, or anything, a PhD, you know, a degree does not shelter us from any of that. And I think one of the things that's nice about this forum is to be able to be vulnerable around that and let people know that what they're dealing with, we completely understand. And that is why it becomes so important for us to advocate so hard in the paint, right, for our people.
In the paint, in the center of the issue. It's so true, because I think when you're in these situations, it's very easy to think that it's just you. You're the problem here. You are the issue. And I think the woman that asked this question, she's asking from her perspective. She's in the middle of this too, and she's wondering, you know, and to your point, these forums are important because it's important to get the information out. It's important for people to understand they're not alone. And then it's important for people to understand what we might be able to do to get through, right? And to see that we can get through, and we're all in this together, and we will make a change. So another person said, oh, Shonda, although I know that the issue is not simple or cut and dry, I think the fact that people outside of the field do not understand how the healthcare system works or breaks down, and the many subsidiaries or dichotomies inside of the healthcare field plays a ginormous part of the problem. Any ideas on how to address that issue? I think that's around, you know, just not really understanding the healthcare field and the systems within the healthcare field that may be at play here.
I do want to mention something around you know, there is this entity, they've been called health navigators, and they've used them for many chronic diseases, in terms of people who have asthma, people who have heart disease, people who require moving through multiple systems. And what we've found, although a lot of these models haven't, you know, scaled across the nation, but these kind of models where we're looking at peers, people who actually have gone through that issue, who are of that, who understand whether they're also an immigrant, also of your race, also, you know, a mother, whatever that is, being able to provide that knowledge in a way that allows for them to spend time. Because I think that's one of the hardest parts about being a physician, is that in order for the place to stay afloat, you have to see so many patients. And I'm a pediatrician, so I don't even talk to you about what that looks like on our end. You've probably seen it in person, how we run from room to room. But I think it's really important to understand that what we need to do is really think about, and I always use international I think that there's so much to learn. Like America's a little arrogant, or a lot arrogant, and there's so much to learn. So community health workers are an entity that really came over here, right? From low resource countries, and thinking about who are people within our communities who we can help to build their celebrity, quote unquote, and build their knowledge base and allow for them to really speak to the community in the way that they understand, and also decentralize health and education and information. Let it not be so patriarchal that it sits only with those that have lived in this certain moment, but being able to get it out. And so I think those models of healthcare navigators, community health workers, are things that more communities and more organizations really need to come on. But I'm sure Dr. Brandeis and her work probably does a lot around community outreach and engagement. So I'm gonna stop.
But that's a really good point, because I think there's been a lot of evidence and data out there to support that these models work and these models make a difference, but yet it's not standardized. It's not universally adopted. So it's like, what do we need to do? And, how do we need to make that change? And I mean, I've worked with various organizations that, have trained and used community health workers or navigators. And, again, it's that trusted relationship that they've built with the community, because 9 times out of 10, they're from that community, they're from that neighborhood, and they can relate to what's going on and speak to the community members in a manner that they understand, and they're transferring that knowledge and providing that access and that linkage. So it's like, again, we have data, we have evidence that these things work. Why are we doing anything about it?
Why aren't we?
I think what I see sometimes, in those spaces is that that navigator or that liaison, that person, that in-between person, their approach to engagement isn't well received on the other end, right? So it's that shifting, that masking, that why am I drawing a blank on the word? Probably because I hate doing it. Not shifting. What's the word we do? Code switching. That's it. Where we code switch between that familiar and familial conversational engagement, and then we have to code switch back over into speaking with people in a way that's palatable for them. And then I think sometimes when people misunderstand our language and our engagement, they question whether or not we're being professional, or whether or not we're really communicating what they want us to communicate. Because I've been a social worker, right? And I've been able to come at my clients and my folks in a way that wouldn't be accepted in the boardroom. So here I am code switching between what's familiar to my clients, and then having to go back and report that out in a different manner to the people that I had to answer to at the time. And so I feel very privileged, and I think each of us are in a very privileged space that we are able to be, hopefully for you all, and from what I see, right, be our full authentic selves, finally. And for me, I had to arrive at that. I don't know if you all have been there, but I had to arrive at a space where I was my full authentic self in the boardroom, in the hospital room, in the patient's room, in the classroom. But it took many, many years of code switching and wearing that mask. And I think that's, sorry about the tangent, but I think that is what I saw, and what I continue to see is that people aren't very receptive to the way that different communities engage and communicate with each other when they're in that navigator role. They want you to be a little more scripted, and that's not always received well.
Yeah, it's not always effective, right? But if you're in a navigator role, then likely you're there because you know how to communicate with the population, so but we still have some work to do, it sounds like.
I mean, this comes really down to money, right? Let's be very frank, but these models aren't paid for. So you can it's not a navigator role, it's a well-trained role, a doula, right? And the idea that we have all of this information, all of it about the impact that doulas have in maternal mortality outcomes, but still no one is biting on being able to cover that and have that covered by Medicaid and have that covered so that then those people who don't have the money to access it are able to do that. And I think it really boils down to thinking about kind of where the levers of power are, where are the, what is it that we can control and regulate and accreditate, and that is particularly, that's going to require new policies. That's going to require a push, like, power will not, like, you will not release it without a demand. And I think that what it's going to take, because a lot of times I know for myself, a lot of times you kind of normalize the dysfunction and the lack of efficiencies that we see in a lot of our communities, and it's kind of like, well, that's just how it is. And it's not until we are really pushing the grain, like building a practice that is beautiful, if you ask me, within the neighborhood that I went to school in, and like being able to build that and having people come in and be like, oh my God, this is beautiful. That's sad, right? That's sad that the expectation was because you can't, you have Medicaid insurance or you're low income, that you don't deserve, or the places that you frequent shouldn't have really a beautiful space that allows for you to really feel welcomed and feel nurtured. And so I think it's really important for us to start thinking about, why aren't these things happening? I mean, because they're happening in our communities, and unfortunately, just like everything else, we have to demand and fight for these things, unfortunately, and it shouldn't be our role and responsibility to do so, but because we didn't create these issues, but that's where we're at.
Yeah. And if we want change, then, in some cases we have to do what we have to do. And I think it's not a one-pronged approach. There are probably multiple ways to come at this issue, but we got to fight it from all of the ways so that we can seek the real equity that we want to see. One thing I want to ask, because I know we're short on time. This time just moves so quickly, ladies. It really, really does. But I want to just really quickly ask the question, because the premise of the show was healthcare. What's race got to do with it? I want to know what's race got to do with it. What are your thoughts on the weight that race plays, or racism plays, in what we see as far as healthcare disparities or healthcare inequities?
Racism is a pandemic, period, right? Like it, and Simone knows, I speak on this, I present to medical students in a couple of programs, and my presentation is literally called Racism, the Longest Pandemic in History. Stress, if we equate racism to stress, those the microaggressions that you deal with and navigate daily, the biases that you have to deal with and navigate daily, all of those things lend themselves to stress. And it's stress that is unrelenting, like you just can't escape it. And so if, for people outside of, Black and Brown communities, if you understand that stress can impact your blood pressure, which impacts your heart, if you can understand that stress impacts your mental health, which impacts your sleep, which impacts your heart. I mean, all of these things, the stressors that we have just showing up Black every day, and the racism and biases and microaggressions and just the load that is code switching, is just that constant stress that you just never get to recover from and have relief from. And so over time it compounds and manifests as poor health outcomes. But that's just one way.
I mean, I would say, if nothing else, 2020 has showed us that race is evident in healthcare. What other people have been long able to deny or say was not evident has been brought to light in so many ways, right? Just the fact that how COVID has impacted Black and brown communities. And, now the ability for people to be able to, if they are getting sick, how are they being able to access healthcare? How are they being able to access vaccines, right? Trust and know that race is explicitly being highlighted in every one of those instances, right? And a lot of it is, like Dr. Omalara said, it's just resources, right? So at a very high level, it's just the resources that are available in the community. It's so systemic. And then it just trickles down when you have something like a COVID happen, right? It just highlights even more the problems that have always been there, but if they've been easier for others to deny or to say that it wasn't their problem, or to say, or put it on the patient, put it on the black and brown people that they weren't taking care of themselves, right? But something like a COVID shows like, no, the problem is so much bigger than that. It starts so high, and then there's just this huge trickle down effect. And I feel like, all of it is really based on race, but it's the systemic racism that in this case has really, really affected us as a people.
And I also want to add to, when we're talking about race, and something I learned from Dr. Brandis as she was talking about racism as a pandemic, is how the medical system is a racist system. It's based on, algorithms that are not necessarily friendly to persons of color. And I think about when just personal experiences, when I show up at the doctor's office, they see a Black woman. They don't see a Black educated woman. They see a Black woman and they treat me as such, right? So when I look at my treatment plan, is my doctor taking into consideration that as a Black woman, I have X amount of stressors that Brandis just talked about? Is there a way to personalize my medical treatment, my healthcare plan that fits me as an individual within the context of my environment? Is that possible?
One of the things that I think is really important that was discussed is kind of this allostatic load, the idea of that chronic stress, which causes literally your systems to become dysregulated, right? And so what we see manifests as more cardiovascular disease. What we see, I myself have an autoimmune disorder that I didn't think I was on the path to have, but got diagnosed with it in the wake of having burnout as well. And thinking about all of these things, I think, is really important. Thinking about the vicarious trauma we see when we see people who look like us shot, when we see, and understanding that racism is not only a public health crisis, is it also is a disease that is actually causing us harm in terms of trauma, post-traumatic stress, understanding the mental illness from that and the depression, the anxiety. Black women in general are one of the highest subgroups with anxiety, particularly social phobias and social anxieties, because of what she talked about with code switching and not knowing, okay, how am I supposed to be in this situation? Who am I? And doing all of that, and then realizing that now, I'm anxious and I'm building up all of this fatigue. I think when you take high burden plus medical low medical servicing, right? And you take those two, it's the perfect storm, right? To have lots of disease that is unmanaged and also overwhelming. And one of the things that we have to do is recognize, right, these are remnants of slavery. We have to recognize that the way that, certain things about our lung volume, certain things about our skin, how well we're able to tolerate pain. And literally, I learned that there were certain medicines that you had to give to Black people for blood pressure versus white people. And unlearning this is very, very, important. But it's also not happening. And what we're finding is that when people are talking about it, they're getting fired from academia. And so we have a lot of work to do, but this is always going to come down to policy and centering and banging the drum that these things need to change.
So I want to be cognizant of time. I know we only have Dr. Omalara for another 7 minutes. So I do want to get down to this question because I am interested in hearing all of the panelists be able to speak to this. We talk about these issues. We know that we have them. They've been long standing and they're still existing. But I want to inspire some hope. I want to inspire the next step. I want us to start thinking about what we can do going forward, right? To see the changes that we want to see, the changes that we absolutely need. So why don't we talk a little bit about that in the final couple of minutes, and then we'll take some questions after Dr. Omalara has to drop off. But why don't we just spend a couple of minutes just talking about what can we do in light of all of this?
Oh, I know I'm going to leave soon, so I figured that why not
You
speak?
go first, girl.
Thank you. I won't get the fun of the Q&A, which I think is usually the best part. But I think that, I do think that we need to, if anything we've realized during 2020 is how important government is, and not the presidency, that's important, but locally. And I think that we don't realize how much power we have, right? Alice Walker, most common way people give up their power, right? is not realizing that they have it, right? And so I think that it's going to be important for us to get involved, to see like, what's happening in this school board? What's happening over here with this hospital? And also understanding who our networks are. We don't realize how large our networks are in terms of people who are in certain situations that can give us certain information. I know one of the things that we're working on are working on bills and trying to like actually think about, okay, there needs to be an act that is focused on protections for patients. One of the things I think that has been very clear from a number of cases is patient advocates are something that are in hospitals, but when it comes to racism, I'm not sure how to help you, ma'am. I'm not sure, those kind. What is not measured it doesn't exist. So there are no reports of medical racism that happen. There's no body that we report this to. What we've seen is there are no repercussions for hospitals that continue to perpetuate these issues, and that needs to change. And so while I think that, there's a lot that we're doing, a lot that's happening around maternal mortality, and I think that this work needs to really expand and see like that these inequities are very large in scope, and also that there aren't any things within healthcare institutions that help to address them. And we need to actually write those things in, whether it be at the state level and whether it be at the local level or at the federal level.
Very good. Any other ideas on how we can affect change here?
One of the things that I really do is I talk about patients becoming their own best advocate and just ways that they can do that, right? I always tell my patients, especially if they're older, it's always great to have, and it's harder now with COVID, of course, but another set of eyes and ears, right? Because oftentimes when you go to the doctor, if you go by yourself, you get so much information, and sometimes it's hard, especially if you get any bad information, or, it can be overwhelming, right? So having another set of eyes and ears in the doctor's office with you can be great. Writing down your questions ahead of time if you already know the things that you want addressed. Slowing the doctor down, right? I have people all the time be like, can you say that one more time? Can you explain that another way, right? Feeling and knowing that it's okay to ask questions and empowering yourself to be able to do that. And I think it's always really nice when you have somebody there with you that you can both ask questions. You can, write down, can you explain that another way? Asking for printed handouts. I think all of those things should be afforded to you. And oftentimes I feel like people feel very intimidated in a system, right? Or you feel like, oh, I don't want to, the doctor's really busy, or, they're moving around and I don't want to bother them and stuff like that. But I tell people, I'm like, this is your time. That is your visit, right? You owe it to yourself to get all the answers you need. And if you're not getting them, you owe it to yourself to ask a question and be very forthright. I don't understand. What did you just say? How do you spell that, right? Like, what is that word? What does that mean? Can you say it another way? I have people ask me that all the time, right? Or how can I Google that? How can I get more information about that? I think all of those things you have to do. And if you're still walking out of a doctor's office and you're still like, something's not right, I don't understand, don't be scared to get a second opinion. I think all of those things you have to be able to do, but you have to be able to do it for yourself, right? Because one, the doctor's not always going to know. And I am a doctor. And sometimes, I'm doing a gazillion things and I don't always pick up on, maybe they have another question, I'm not sure. But if you're not doing those things for yourself, or if you leave my office and you're like, okay, I understand, I can only assume that that is what it is, right? But it's the fact that you're asking questions or you're letting me know that you understand. And, sometimes I'll say, well, can you explain it back to me? But I don't always take that extra step, right? But sometimes if you repeat back to the doctor, so did I hear this right? So you're saying I have X, Y, and Z and I need to do this? You want me to take the medication this way? That helps us to know, but the doctor doesn't always, or the provider doesn't always take those steps. But you can ensure that they do that. And I think all of those things are helpful. You have to be your own best advocate. You have to ensure that in that visit, you're getting what you need. And if you're not, then that's when you need to slow that provider down, slow that doctor down, ask more questions. And if they are not engaging with you, then that's the time when you have to be like, I probably need to see somebody else, right? Because you're supposed to be a team. And if that other part of that team is not receptive to you asking questions, not receptive to you needing a little bit more time and information, then what kind of team is that, right? And so I think all of those things go into it. And these are all things that I do for myself. But when my mom goes to the doctor, best believe I go, right? Or my dad, he lives in another state. I'll tell him, Dad, call me when the doctor is there. I need to ask some questions because I know what my dad's telling me sometimes doesn't sound right, right? So all of those things your doctors will do or your providers should do, right? And so if they're not, then you need to be wondering why or wondering how you can get better care.
Yeah, that's really great. So I heard legislation, I heard being your own advocate. These are things that we can do. These are things that we can push for. Now, there are some structural sort of institutional things that are barriers to that. But again, we can press, right? We can knock down the door. So these are things that we can do and to take some of the control back into our own hands. Did anybody else want to share some ideas on that?
I do. I think oftentimes we wait way too long to seek care. We think we can figure it out. Or, oh, the pain isn't that bad, but realizing that your pain is a symptom of probably potentially something greater, right? And if you wait too long, now you're in a position that what maybe could have been corrected now will be more challenging and more debilitating. And now your life has changed in a way that maybe it didn't have to if you had not waited so long. And I know it's scary, right? It's scary to think about what that pain is or what that lump is or what, all of a sudden these changes and it's kind of a loss of control, but knowledge is power. And so advocating for yourself, finding that physician that you trust or that provider that you trust, and asking questions, just like Dr. Julie mentioned. I think another thing is to, we're often, culturally, I think we're very private and there's something to be said about that, right? Like you hold things close to yourself and keep things in your family, but that is also isolating. And we feel like no one else will understand this experience. But I have often said to my patients, you are not the only one singing this song. When I worked on the mother baby unit, I would have moms who would cry and say, my baby isn't latching or I'm not producing enough milk. And all I could say was, it's only day 2. It's you're 48 hours, you're 36 hours in, you're doing exactly what you should be doing. And I would work nights, and I would want to pull them into the hallway at 2 a.m. and say, can y'all just sit together and talk to each other? I wanted to do that so desperately, so that these moms would understand that they were not alone. But if you are afraid to share your story because you think that this is only happening to you, then not a whole lot will change. And I can say that yes, this is happening for other women, but until you hear those other stories, you don't really know. So I think the idea of centering is really a great opportunity for women to share experiences with their pregnancy and with their childbirth and all that jazz. So sharing your
And
story.
I would definitely support that, because I actually had the opportunity to observe and participate in a centering pregnancy group prenatal care model, which I love. And that aspect of social support was something that the women really talked about and valued and latched onto it, to the point where you would have, first time moms in a group with, moms who had other kids, and they can talk about their experience about, oh girl, don't worry about that, this is how you do, and actually give like really informative advice or information or suggestion. But that, building that support network and that social capital where, if I don't like my doctor, I can say, hey girl, who you see? Is there another doctor that I can go to, because I don't like the one that I'm going to. But like Brandon said, some things you need to keep private, yes, but that shared experience, I think, is also crucial in getting information out and raising awareness that this is not a solo issue. There are multiple people going through this, and there's a collective that can have an impact on making, things change.
I want to jump back to something I think Dr. Brandis, you said, where you mentioned not waiting. I believe it was you, not sitting in your pain. And another individual that was on my show some time ago, she is like a mental health sort of therapist and coach. She was on a live not too long ago, and she was speaking in another context, but she said, my blackness is not my pain. My blackness is not rooted in my pain. And I wonder if we sit in it sometimes thinking that I'm stronger than this, thinking that, I had something like, somebody else had something like this before and they were fine, so I'll be fine too. But maybe that's where some of this comes from, is that some of this generational stuff, right? Where we feel like in some ways, like pain is okay, or some pain is okay, and we shouldn't complain. We shouldn't make a big deal about it. We shouldn't be proactive, and not even thinking in that way, right? But we shouldn't, make a big deal and cause a fuss, because we can handle it and we should be able to. So I wonder, some of what we got going on sometimes too.
Dr. Omalara touched on it very briefly when she mentioned that strong Black woman trope. I mean, there's tons of research on it. You can Google it, SBW, strong Black woman, superwoman complex, superwoman persona, where we feel like we deserve to take on, or it's our obligation to take on the weight of the world or the weight of our family. And it's self-sacrificing. We don't even acknowledge our own pain because we are helping other people navigate theirs. And so how dare I burden you when I already know what your burdens are? But I think there are two parts, right? Like Zora Neale Hurston said, if you're silent about your pain, they'll kill you and say you liked it. You have to advocate for yourself. You have to speak up. But then the other part is, there's also research just as recent as 2016, where white medical students at the University of Virginia, the majority were surveyed and believed that Black people actually could tolerate more pain than white people. Not only did they believe that Black people could tolerate higher levels of pain, but they believed that Black people literally had thicker skin. This is 2016 that this research was done. So it's not only we're holding on to our pain, but sometimes when we express it, we're not taken seriously. Believe Black women, believe Black men, believe us when we say that we're in pain, and treat us appropriately. And so as a result of that, disbelief of our pain or not acknowledging our pain levels, we are not treated adequately. And so then we have that learned hopelessness or that learned helplessness of, well, I tried and they didn't listen, and so I must just have to carry it, as opposed to getting a second opinion or knocking on that door or knocking on those, knocking down that wall and advocating for yourself until you get the treatment that you need and deserve.
Right, right.
Yeah, and I will echo, I definitely think the idea that, especially in the Black community as females, we take care of ourselves last, right? In our efforts to take care of everyone around us, everybody else will have a dentist appointment, everybody else will have a doctor's appointment, everybody else has their well visit. And so we do ours after everybody else, but sometimes that comes 3 years later. And I've had patients tell me that, right? They've been taking care of a sick whoever for 3 years. And so they've done nothing because they were the caregivers for everybody else and they just couldn't get around to it. And I think sometimes we can be our own worst enemies, right? Because we have felt that lump or that bump, we've been wheezing or had whatever going on, but we just have not taken the time to take care of ourselves. And I tell people, like my patients all the time, none of those people in your family will benefit if you are no longer there, right? And so we have to let people know, I just need an hour to do this one thing for me. I need this appointment. And then you can take care of everybody else, but you gotta be able to do that first. And we sometimes are the worst at doing it for ourselves. We will do everything for everyone else. But we don't often take the time to do it for us because we feel like, well, I'm going to be okay. I've got to do this first. Who else is going to do it? Nobody's going to do it as good as me, right? All of those things that we put that pressure on our shoulders. And I think by sharing, by talking about it, by sharing, even in your own families and saying, hey, I've got a lot going on. Can you take some of this off my plate so that I can be able to do this? Because I'm sure for many families, they would, right? But we put a lot of that pressure on ourselves that we have to be able to do it all and not let those in our immediate circle know that we are having pain or issues or whatever it is. And so they are unaware that we are also in need.
If I can just to go to piggyback on that, like, I just love everything you said, Dr. Dooley. And I feel like, oftentimes I'll say this. So my research was on strategies for health and well-being for Black women in predominantly white spaces. And so what I came to learn was to even get to that space of health, wellness, and well-being, it has to be founded in self-preservation, meaning take where you are and make that the minimum request, the minimum that you will accept from yourself or anyone else, and then build on that, right? Regardless of how, maybe you've had years of self-neglect, maybe you've done all those things that Dr. Dooley said and have been self-sacrificing. But if today you decide that I am going to ground myself in self-preservation, preserve the level of health that I have now as my minimum level of acceptance of anything, and build on that. Don't accept less from yourself or anyone else. And that's mind, body, spirit. Be purposeful with how you spend your time, what you put in your body, how you move your body. And I'm speaking to myself, but I'm hoping that I'm speaking to someone else on this Zoom call, because that self-preservation has to be paramount. Like, preserve the level of health you have now and build on that.
Absolutely, absolutely. It's so funny. We had to bring it all full circle. And I'm so glad that we did, right? Because they're with these issues, they're not one dimensional. They're like 50 dimensional. I don't even know. There's so many factors to this. And we touched on so many tonight, and I'm so glad that we did. It just highlights the complexity of the issue. It highlights the multiple different ways that we have to go about addressing it. But I'm so glad that we took the time tonight to really not just look at the external things that are a part of our healthcare outcomes or healthcare, but also to look at ourselves, to really look at ourselves as well, and to say, well, what can I do? What can I do to affect some equity in this space? So I'm so happy to have this conversation. There were a couple of questions in the chat. I'm just going to maybe just the one, and because I know I want to be cognizant of everybody's time. There's some comments there, so definitely take a look after we end the call. If you want to respond to those, go ahead and do that. But there was a question I want to get to, and then we'll end the call with just kind of, sharing again who you are, and if people want to reach out to you, if you're open to that, and your platforms. So the question that I want to ask is, what can be done to heal the mistrust that Black and Brown people have in the healthcare system? Now that's a loaded one to end on. Any thoughts?
I personally feel like that is not for us to do, right? The mistrust of the Black and brown, that's not for us to do. We are trusting people. It is the system that now needs to start to earn back our trust, because we don't trust them for real good reasons, right? And so when my patients come in and they don't trust me, I understand why, right? The healthcare system has really taken advantage of Black and brown people. It is the healthcare system's job at this point that they need to show us that they care. They need to take care of us the way that they take care of everybody else. They need to get rid of these biases and these inequities. They need to earn our trust. It is not on us to do that. It is not. I would never put that on our community, because we have been overly, to a point, trusting. And so it is now for them to do.
Yes. Any other thoughts on that? I mean, that was kind of a mic drop. I mean, I agree. I totally agree. But any other thoughts on that? Just about mistrust?
Yeah, I'm gonna second Dr. Dooley's comment, because that's a systemic issue. That's a larger issue that goes to accountability, that goes to those inequities that we talked about for the last hour. Like, you have to be able to start and implement policies and build relationships with those communities that you've harmed, that you've neglected, that you've marginalized. But on an individual level, again, you have to be a consumer of the healthcare system. Like, you have to understand what you need from the healthcare system. I remember some conference or something I attended, and one of the speakers talked about how the medical industry complex is not meant to be a place of healing. They don't care about you. It's literally a business. And I think someone mentioned it on this call, the healing and the wellness starts in the community. Like, it starts with the people that we know, the people that we're comfortable with, the people that are in our circle. So find those people who can help support you in whatever your goals are. Like Brandis just mentioned, if you are making a commitment today that you are going to do better, you're going to live healthier, find those people that can help you get there and start there.
Wonderful.
Absolutely. Find your tribe, lean on your tribe. And I think Dr. Dooley and Simone pointed out so perfectly that, it's a systemic issue, right? But I think it's sometimes that's so vague, like, okay, well then who do I blame? Like, whose fault is it? If it's systemic, who do I call out? And I think those are our educational system, our housing authorities, our medical organizations. I mean, we have to, Dr. Omalara said this several times, we have to really get at the policies and hold people accountable, the decision makers accountable. And she's right, it's not even at the presidential level. We have local government. We have, we can't just turn out, every 4 years for the presidential election. We have local people that we need to hold accountable and make sure that they are advocating for us and have our best interests. So being knowledgeable about who the decision makers are, where the money goes and flows from and to, and really just be knowledgeable. Don't wait for someone to call you out by name and invite you into spaces. Bring your chair to that table and have a seat and learn, and then advocate for yourself and speak up.
Very good. I want to give each of you an opportunity to just share your platforms, if you have one, and any information on other things that you're doing with the community that has been watching tonight.
So like I've said, one of my big things is advocating for women. And so I have a podcast and a platform. It's Weight Loss for Women, really starting to help women advocate for themselves. And because often, why times what I see is that, the hypertension, the type 2 diabetes, the cardiovascular disease is really because a lot of us have not taken care of ourselves, right? And starting at that minimum baseline. And for a lot of women, especially when you are in these, you know, healthcare deserts or food deserts, like how do you still take care of yourself? And you have to be able to do that. And so my podcast and my platform is all about helping women navigate those spaces and take care of themselves despite whatever the circumstances that you're in, right? And so you can always find me. My website is yashikadooley.com. And the same thing, my podcast, Weight Loss for Women, and you can always just be able to interact. And I do very similar Zoom calls where women just come on and ask questions and we talk about all the things in healthcare.
Very nice. Thank you for sharing. Anybody else?
I do some coaching and consulting, and so my website is brandpair.com, BRANPEAR.com, and there I provide support with leadership development, future planning, goal setting, and I also do tons of these, like Dr. Dooley said, where I enjoy speaking engagements and sharing strategies for wellness and well-being, and also unapologetically speaking on racism as a pandemic and strategies for navigating that on an individual level and on an organizational level. So brandpair.com.
Very nice.
Yeah, I'm gonna need to get with y'all ladies.
I am too. Yes.
To build my brand.
Yes,
So I just really enjoy connecting with people. I consider myself a community connector. People will call me, hey, do you know where I can find this resource, or can you point me in the direction of blah blah blah? And I would help connect them with resources, with people, with networks, because I truly believe that that engagement piece, that networking component is really crucial, so you're not feeling like you're alone. So I would say anyone who is interested in connecting with me, I'm happy to share my email. I don't know how, but it's smone151@gmail.com. Happy to connect anytime.
Thank you. And I'll share a little bit too on Dr. Omalara. So she has a community. It's strongchildrenwellness.com. That is the website where you can find information about the initiatives that she has going on there. And for support for Black women health professionals, it can be found on Instagram, Melanin Medicine Motherhood, and at www.melaninmediциnemotherhood.com. All of you ladies are so phenomenal and so amazing to be here and to share your perspectives on this issue, but more importantly, to share with us a little glimmer of hope and how we can navigate through this inequity. So finally, I always ask the panelists, what is your final message in regards to health inequities, in regards to health disparities? I just want to end with just a final message for the audience on what we discussed tonight.
I guess I'll start. I would just say you have to be your own best advocate for you and your families. You just can't assume that the healthcare system is going to do it for you. We're going to try to continue to enact change, right? But until then, you are your own best advocate, always and forever. Ask a question, ask again, or get a second opinion, whatever it takes.
Very nice. Thank you, Dr. Lashika.
I would say get engaged, get involved, be an active participant in your own healthcare, aspect, and just be involved in your community. There are lots of programs, there are lots of services that people don't know about, that can really be helpful and useful to our community. Again, educating yourself, advocating for yourself. I can't say that enough. But most importantly, just be involved, take an active role in your health.
I will say, love yourself enough to know that you deserve more than you have now. Love yourself enough to advocate for more. And there's a quote by Nikki Giovanni: deal with yourself as an individual worthy of respect and make everyone else deal with you the same way.
Beautiful, beautiful. Thank you so much, ladies. I know we went a little over time, but thank you so much for spending your night with me and sharing your knowledge and your perspective on this topic. Like I said, I can't thank you enough. And I look forward to future collaborations with each of you. Yes. Good night, everyone. Thank you for being here.
Good night.